Thank you so much for joining us today for our No Stupid Questions podcast. I'm Dr. Kim Bissell, the Southern Progress Endowed Professor in Magazine Journalism and the Associate Dean for Research in the College of Communication and Information Sciences, or CNIS, at the University of Alabama.
And I'm Dr. Annalisa Boland, an Assistant Professor in the Department of Communication Studies, also at the University of Alabama, and we both work in the Institute for Communication and Information Research, or the ICIR, at UA. So I have to note for our listeners that Kim and I both use fitness trackers, and we have for years. So Kim, what do you use yours most for, and do you trust the data?
So this is such a good question, and the answer is, do I trust the data? Sort of. I use a fitness tracker every single day, and I got this new fancy health and fitness watch that is linked to an app, and I do feel like the information is correct, or at least I hope it's correct. However, my watch is pulling biometric data from me and putting it into the app versus me self-reporting my health information. Because let's be honest, if I were self-reporting into a fitness app like I used to do before I got this fancy watch, I might fudge just a little and say my 4-mile run was a little bit faster than it actually was.
Yep, totally agree on that. And, it's interesting too, because sometimes, I've seen on the news where other people can track your information.
Yes.
And so sometimes, I don't even stop at my house when I stop a run or a walk, because I don't know who else is out there looking, and I don't know if I want people knowing where I live. It's
right.
Scary. Well, today's guest is Dr. Shaheen Pandawala, an assistant professor in journalism and creative media who studies many practical things as they relate to health communication. For example, Shaheen studies the way people like us use these health-related technologies like health apps, and she further studies how we use things like online health communities and who is using that data that we're giving while we're working out, or maybe just while we're sitting around. Welcome, Shaheen.
Oh, I'm happy to be here.
Thank you so much. So we have to ask a fun question. Are there any health apps that you think are particularly good or that you like, or health apps that you think aren't particularly good?
Oh, that's a question I did not anticipate right off the bat. No, which is fine. I'm just gonna have to think on my toes. I think that one of the ones that I used to use briefly was MyFitnessPal, but it's just become such a big juggernaut now, so I don't even know. I stopped using it at some point because it didn't personally help me. That's just sort of not my personality, where you do the competitive thing and kind of keep track, because I started feeling bad about myself, which is sort of what you see with health app research, right? So it's like you're an inherently competitive person, or you have these intrinsic motivations that align with what the goal of the app is, then the apps will be really helpful and useful to you. But on the other end of the spectrum, if that's just not the sort of person you are, it can have this sort of backlash effect, which is something that I kind of started noticing within myself. And so I just sort of put it away. I do use a couple of more practical, I use an iPhone, so the phone itself now, like everything else around us, pretty much tracks everything we do. So, that the phone itself tells me a little bit about sort of my movements and things like that, basic information. But also just being a woman using technology, I also use sort of a female, the menstruation app and things like that is just sort of really helpful to keep track of a lot of different things. And yeah, so it's more practical rather than motivational for me. I don't know if that sort of was what you were looking for, but
that's great. Thank you.
Yeah.
So I guess kind of following that up, can you give us a short elevator pitch on your research?
You guys actually did a really good job covering what I do in the intro. So I don't know if I'm going to go over and above that, but just to kind of just to kind of try my best. Basically, what I do is sort of look at how people use technologies to kind of self-manage their health. And I started off by looking at this through like a chronic illness lens, where I was focusing a lot on illnesses like diabetes. And that's sort of what you mentioned about online health communities. I've looked at diabetes communities and such. But today it's expanded more to sort of just general health, because what used to be siloed spaces like online communities, even just a few years ago, has sort of infiltrated our regular usage of online websites and social media even. So half of what you're kind of looking for, it might be intentional. You go in there to search for these things and you look up health information. But another part of it is just accidentally and incidentally coming across health and science related content online, and sort of how people use that to make health decisions for themselves. And so that's just sort of like what life is today if you are interacting with technology. And so that's kind of part of it. And I think that was more than an elevator pitch, but we'll pretend it was a really tall building.
So if you had to come up with a headline for one of your more interesting findings, what would that headline be?
So one of the things that I noticed in a couple of different research projects in different ways is, and not only my research, but other research in the field even, is often this sort of bandwagon effect, if you may, where people see what other people are doing and sort of make judgments based off of that. And so in one of my papers, I called it sort of like borrowing credibility, where we were specifically looking at health apps in the App Store. And what people would do would be like, oh, I'm looking at the reviews and the ratings of these apps, of these health apps, and it seems like it has 5 stars, or it seems like it has a lot of reviews. So I don't just want high ratings. I also want a lot of reviews, right? A lot of reviews saying positive things. Right. Or alternatively, if someone has told me about this app personally, so I have this sort of word of mouth approval about the app. So again, you're borrowing from people in your personal life. And so it's very interesting to see this sort of like monkey see, monkey do behavior. Which is kind of common in human nature, because we place a lot of value in the source and sort of what other people think about things in general. But like that sort of extends to not only technology, but even health-based technologies to sort of manage your own health, basically.
Do you look at how people, or what the outcomes are also with people who use these apps and are in these communities?
So unfortunately not, because it's just a whole different challenge, right? Looking at health data and all of that. So it's something that I would like to explore a little bit down the line. So oftentimes it kind of stops at intention rather than actual behavior, which is sort of what we do a lot in communication research, right? We like look at the intention, which sort of explains future behavior. And that's I don't want to say it's a cop-out, because it's not a cop-out, but it's kind of a cop-out. But
well, and the reason I ask is, I use my Garmin watch and the app, and I was feeling particularly into my health and steps one year, and decided that I was every month going to up it by 1,000 steps a day.
Oh, and that's great.
Yeah, right. So, I mean, I got up to 15,000 steps a day. I'm doing great. And then I land myself with gluteal tendinopathy.
Wow.
And the app didn't tell me I was going to get that.
Right.
or what to do with it.
Right. And I think that's sort of the challenge with a lot of these technologies. And even in when you go back and look at like online health communities and stuff like that, where one of the things that I noticed on those platforms were like people would ask questions about sort of how to help their own health conditions and how to fix certain problems.
Mhm.
And then people in the communities would help them and tell them, oh, this was my experience or this is what I did. But there was this sort of like not necessarily correcting, but moderating effect where people would be like, oh, this is what I did in my situation, but you should talk to your doctor before you do it,
Right.
because each person is different, right?
Yep.
So it's kind of harder for a technology that is not connected to any sort of person at the other end to maybe make that decision, despite the fact that we have moved like leaps and bounds in technological advances over the last few years. So yeah, that's a really interesting anecdote.
So Shaheen, I'm sort of curious because I know, I've got like a running app that I use, and it's got this group we're all assigned to, and other people who are on like dieting apps and fitness apps, they are part of the group. And I think the thing, and you kind of alluded to this earlier, is that, I may go out and run and be really proud of what I've done and like really happy with it. And then I report in or check in with the group, and it's like, oh, well, I ran 12 miles or I ran 22 miles or whatever it is. And so this place that you're supposed to find this sense of community winds up making me feel dejected. You know what I mean?
Right.
And I'm wondering how common that is, or kind of what you've learned in your study of these online health communities.
So it's not as uncommon as you would think. It's actually pretty common. And again, like I said, right, it depends from person to person, but basically people do really like the social element that you described. So having that sort of social competition, so seeing a family member do the same thing that you're doing, or running in a group of friends or whatever, sort of like gives you that social competition, so to speak, and you push each other, whether you actually that was the goal or not, but you push each other to do more, to do better, whatever your goal is. But then at the same time, there's this sort of backlash effect where it's like, if you are not getting up to the level of other people, maybe, right, people tend to feel dejected, whether it's like you're not keeping up with other people in the group, or whether you're not keeping up with your own goals. So like we have talked to people where in the past people have been like, it takes a lot of discipline to do this, or it takes a lot of like time and motivation, and if I don't achieve that sort of thing, I'll just stop using it, right? I'll just give up, or I'll use it for a little bit and figure out what I need from it and then stop using the app. So I kind of got what I wanted from it, but I'm not going to continue doing it.
How did you get into this research?
I guess it's just, I was interested. This is an interesting question, right? So I have a background in biological sciences. My undergraduate degree was sort of not in this field at all. It was in like microbiology and biochemistry.
Wow.
Yeah.
Wow.
So hard left turn.
Oh my goodness.
So I was always interested in biological sciences. I just sort of veered toward the field of communication because I wanted to communicate these issues more than anything. And by the time I was in my master's program, which was a health and risk communication master's program, I'd already done a journalism master's before that, and so I sort of was at that age where I kind of knew what I was interested in, and when I say age, I mean like in terms of my career. I knew what I wanted to do versus what I didn't want to do, and I was technologically as a people, as a world, we were sort of advancing, and so I kept seeing people using technologies to sort of manage their own health issues, and it sort of aligned with my own personal interests. And so that's sort of how I got involved in being interested in health and technologies. And then I just started doing research with my then advisor and sort of stuck with it for how many ever years since. Yeah.
So can you tell us a little bit about how you do the research that you do? And I'm talking sort of methodologically here.
Yeah, sure. So I definitely take sort of a mixed methods approach. I use a lot of different methodologies. I've done a lot of research interviews and done focus groups also. So you have that qualitative component of kind of getting into deeper depth of what people think and getting more rich responses in that way. But we've also done surveys and experimental research. So definitely across the board, content analysis. So like a mixed bag, basically. So definitely different things methodologically. And yeah, I don't know if there was more you wanted about that.
Oh, no. That's great. That's great.
Mm-hmm.
And how do you focus on one, or do you focus on one either social media platform with that area of study? Do you focus on one? I don't know where even apps come from.
No,
I don't even know how to ask the question.
I think I know what you're getting at, and I don't actually hyper focus on one specific platform, whether it's apps or whether it's websites or whatever. It's generally kind of where the people are going in terms of managing health and sort of. I know I'm basically, I look at things from a health lens, but sort of today, health is so intertwined with so many other aspects of life, right? Like health and politics are constantly intertwining, and health and science are pretty much the same thing.
Right.
And so a lot of different aspects that I look at have these sort of I don't even know if it's disciplinary, but like spaces in between, sort of, where and so I'm sort of like following where the people are going for these things, basically, for these spaces. Like I mentioned, we talked about earlier, where I was looking at online health communities specifically, but now I look at similar things on social media platforms. So like where I've looked at WebMD, that is specifically focusing on one, like a diabetes community, for example. I'm looking at another, we have another study that's under review right now that basically looks at diabetes, again, a different type of diabetes, but that's on Instagram. So it's kind of varied because the populations vary and sort of what they're using has changed over time. So it's not, because my goal is sort of not tied to one platform, but more to what people do in order to self-manage, and in the context of technology. And so if they're jumping ship to a different platform, then I guess so am I.
Right. So do you find yourself collaborating with others? Is some of your work kind of solo? Can you tell us a little bit about that?
Yes, sure. It's primarily collaborative. I do obviously limited amount of work solo, but just kind of the nature of the work makes it so that collaborative research is a lot more productive. I do have co-workers and co-authors from Michigan State, which is where I graduated, and at UA, where I currently work on different projects, multiple research teams, which is sort of really great to have people to be able to share ideas with and kind of better structure this work, because it's constantly evolving. And so, yeah, it's definitely, I definitely love working in collaboration with other people, because we got to get a lot of like different insight that I wouldn't have probably come up with myself.
Yeah.
So speaking of that collaborative work, how's the pandemic affecting the research? And particularly thinking, I mean, not only the research, but the collaborations that you have to get the research done.
So it's been sort of interesting, because we, a lot of the work that we do is not like, okay, you need to be within a lab space to do it. So people in the beginning were sort of like, oh, it's going to be a seamless transition. We can just do it from home. Which kind of really quickly you realize that none of that sort of works. But because even though you kind of continue with the research, structurally things have like slowed down. You keep, like, for example, you keep getting review requests, but at the same time, like things that you submit for review just don't come back because they're taking forever to be reviewed. So things like that were like unanticipated. I'm like, oh, okay, like this is not something I thought to like think of because it's not something I can manage. But yeah, so those sort of unanticipated blocks definitely popped up, and trying to work through them basically.
So this is going to be just something I'm really curious about. You know, we're all kind of in this position where we've been working from home, isolating a good bit, not interacting with people face to face. What do you think, kind of when we get out of all of this, and not speaking very optimistically, do you think that we're going to be in a better place in terms of health? Do you think there's been a greater reliance on health apps and online health communities simply because we can't, you know, go to the gym and things like that?
Right.
Or can you just tell us what you think about that?
I think that it's sort of a mixed bag. I think people are like a lot more cognizant about the fact that we're at home most of the time, so you need to sort of make sure that you're getting some amount of physical movement during the day, whether it's actually working out or even just walking around your home and walking around your neighborhood or whatever. So that's sort of been on people's minds, but at the same time, there's only so much that can be managed because you're kind of trying to function within the confines of a pandemic. So it's sort of yes and no. I think today there's a lot more use of things like Apple Watches and other sort of technologies that are not things that you have to specifically remember to add to your, like, oh, I need to download this app or whatever. Like if you're wearing this app, if you have your phone, it's probably going to keep track of a certain amount of things, whether you want it to or not. But so I think people definitely probably use that and use those things to keep track of their health to a certain extent. But at the same time, they're just sort of trying to manage some semblance of normalcy. So yeah, that's sort of why I think it would be like a complete mixed bag.
So given your research, for anyone listening, what would you suggest that someone look for in an app and or a community? If, I mean, I know that depends on kind of what their goals are, but what would you suggest people do when they're vetting an app or looking for an app or looking for a community?
So with apps, there's a lot of different kinds. And when I say a lot of different kinds, I mean there's a lot of different people producing and creating them. Like one of the research projects that's not out yet, but it's close to being reviewed right now. We kind of looked at sort of what people's perspectives are in terms of apps created by private companies versus governmental organizations versus like nonprofit organizations and things like that. And so I think in the context of health apps especially, it's sort of very important to see who's creating this app and what you're getting out of it versus what they're getting out of it, because there's a lot of I don't know how to describe, like, people have a lot of faith when it comes to, oh, this app looks really pretty, and so that probably means it's good quality. Because people have this like notion, they know the correct buzzwords, let me put it that way. They know the correct buzzwords, they know that they have to look for good quality and a credible app, like that's what they're supposed to look for. And generally good quality sort of equates to it gives me what I want personally, right? So it's not necessarily like objective. It could be a good app objectively, but if it gives me what I want, if what I want is an app that like it has bright colors and like large lettering, like large font, and it gives me that, then I think it's a good quality app. So that's sort of what a lot of people tend to do. And that you may luck out and it may be actually a good app, but a lot of times people are okay with using these good quality apps, because quote unquote good quality apps, because They're easy to use. They have good things like UI, UX involved with them in creating them. But if it's a private company that's making this app, you gotta always ask yourself, what are they getting from me? Because if you're using an app for free, then you're probably what is being they're harvesting your data for a lot of different reasons. You're the thing that's the commodity, right? If you're using it for free, then you're the commodity. People tend to be okay with sharing a lot more information about themselves with health apps than they are with a lot of different and when I say apps, I mean health-based technologies, than a lot of different technologies, because the idea is that if the technology needs to spit out a bunch of results for me to tell me how my health is, they need to know about me first, right? You're giving up parts of yourself for A, using this technology for free, and B, sort of expecting things back in return. And that's really valuable in some ways, but what they give you back is really valuable in some ways, but at the same time, you gotta kind of be aware and cognizant, because you hear of apps being bought by larger companies, data being hacked from apps and other technology all the time. Definitely kind of second guess what is being done with your data. Another thing is that a lot of apps are sort of put out by health related organizations, right? The ADA or the AMA, the CDC. It's really hard to get those stamps of approvals for these technologies. And if the stamp of approval is there, if they've sort of created this app, if there is a stamp of approval, then that you're probably going to be fine believing things that come out of there. Those are just sort of a couple of things.
I'm going to be looking at all my apps this afternoon and
exactly.
doing a thorough assessment.
That is correct. So finally, as academics, we have the good fortune of being able to travel to different countries or different cities around the United States for our conferences. What's one of the favorite places you visited when you've traveled to present your research?
Oh, this question hurts actually, because I was supposed to go to Australia this time, this May, but nothing happened. Nobody traveled anywhere this year. That would have been my answer. But I think besides that, I've had some good opportunities to travel to a bunch of places. There was a conference that we attended in Denver a few years ago, which was really great fun. I really love Colorado, so that was really pretty and really great. I think there was one in San Francisco, DC. So there's been a lot of places that we've been to that sort of, as academics, it's a good advantage that you kind of get to see the place and see different places and see the world as a part of this job.
Definitely. And you're not the first one to mention missing out on
that was a hard one.
Shaheen, it's been so great to talk with you today. Thank you so much for spending a little bit of time.
Thank you for having
sharing
me.
your research.
Yeah.
All right. Thanks so much.
Thank you. Yep. Bye.
Bye.
Thank you so much for joining us today in our conversation with Dr. Shaheen Pandawala. It certainly gives us a little bit of pause to think about how many people could be watching or observing this data that we have and input into fitness and health apps. So we are at the official end of season 1 of No Stupid Questions. Y'all, I cannot believe it, but here's great news. We're going to be continuing the conversation and catching up with PhD students as a part of season 1, and that's coming very, very soon. And then season 2, we're going to rebrand. Just like all other things you see in media, we go through a rebrand. So we're going to shift our name to revise and resubmit. But the conversations with CNIS faculty will continue. So follow us on social media, follow us on Twitter, and you're going to learn more about what's coming soon. Thanks so much for being a fan. Thanks so much for listening. It's been great to have you along season 1 with us.